so much. I am going to pull up my slides quickly. Great, and I will get started. So thank you again, Randy, for the introduction. Thanks, Compass, for having us as always. And thank you for joining us this evening. If you have not been to one of our webinars before, we're really excited to bring you this information, especially this month on such an important topic. As we're going, if you have questions or things that you would like answered, please feel free to use the Q&A or the chat function on Zoom, and we will hopefully have time to get to them at the end. If you have not heard of us before, I am Corey Hammond. I'm the Director of Prevention Services at Partnership to End Addiction, and I'm joined by my colleague, Dr. Linda Richter. We also have Olivia Root on our team, who is our research assistant. And so this is what we are going to go through this evening. We're going to talk about substance use, we're going to talk about mental health disorders, and then we're going to talk about co-occurring disorders, which is when both of those things are happening at the same time for someone. We're going to talk about the prevalence of co-occurring disorders. We're going to talk about risk and protective factors for co-occurring disorders, so both for substance use as well as mental health disorders. We're going to talk about the current treatment landscape and what barriers to treatment look like right now. And then finally, we're going to end up with what parents, teachers, professionals, everyone in a young person's life can do to try to help this problem. So to start us out, I'm going to talk just briefly about youth substance use. If you've been to our webinars throughout the year, you might have heard us talk about some of these substance use topics before. We'll talk about mental health and co-occurring disorders. On some of these slides, you might see co-occurring disorders abbreviated to COD. And so that's just that idea of a mental health and a substance use disorder happening at the same time, but we'll get into that later. But so to start out with substance use. So a substance use disorder is an impairment caused by the recurrent use of substances despite harmful consequences and lasting changes to the brain. And so that's the formal kind of medical definition for it. And substance use disorder, we might know it kind of generally as addiction. It does have a legitimate diagnostic criteria. And so it contains 11 different symptoms of a substance use disorder, things that I'm sure we're all familiar with. So things like using more substances for a longer period of time, having difficulty cutting back, time spent getting the substance, using and recovering from it, having intense cravings, not being able to handle your responsibilities in life because of your substance use, giving up on interests and other things that you like, relational problems, physical dangerous situations, and then things like tolerance and withdrawal. So all of these might seem like, common symptoms of substance use disorder that we've heard about before. But this is the criteria that a medical doctor, a psychiatrist, a psychologist would use to diagnose somebody with addiction. And so the little key at the bottom tells us that if someone is experiencing 2 or 3 of these symptoms, we would consider that a mild substance use disorder. 4 to 5 would be moderate, and 6+ would be severe. And these criteria exist for all types of substances. So someone could have alcohol use disorder or opioid use disorder or marijuana use disorder, and these criteria are the same. And this is important because when we're talking about co-occurring disorders, we're talking about someone having an addiction as well as a mental health disorder, another one on top of it. So not just, using substances responsibly if it's legally, or in a way that is not causing them distress or any of these symptoms. But when we're talking about substance use disorder among teens, we know that almost 9% of teens age 12 to 17 met that diagnostic criteria for substance use disorder. So almost 9% of teens met the criteria needed for addiction. And only about 40% of those who needed treatment in any kind of treatment received it. So while 8.7% might not seem like a huge number, we know that it's a large amount of teens that are struggling with a substance use disorder. Importantly, I'm sure if you've been with us, you've seen these graphs before. We know that the earlier that someone uses substances, the higher their risk of developing a substance use disorder later in life. And so for individuals who first tried alcohol when they were 12 years or younger, almost 12% of those went on to develop alcohol use disorder. Meanwhile, the odds for the group developing alcohol use disorder are 5 times higher than for those who waited until 21 to try alcohol. Similar story for marijuana use. The younger that someone starts to use, the much more significant risk they're at for developing a marijuana use disorder as they get older. And so this is why we constantly say it's so important to try to delay use for as long as possible. Some mental health stats before we get into the definition of co-occurring disorders. And I'm going to show a video to start out. And Linda, will you just give me a thumbs up to make sure that the sound works?
Sometimes I think everything's gonna be all bad. I only have negative thoughts.
I think a lot about my relationship to other people.
What if no colleges accept me, you know?
Am I gonna mess up?
Oh my God, you mess that up. Like, look at you go again.
Am I actually a certain way and I'm just perceiving myself wrong?
What if, like, I tore my ACL and I never could dance again?
What if someone else worked harder for this but didn't get it?
My parents are gone for like 10 more minutes. I'm like, dude, what if they got in a crash? What if they got robbed? What if they got stolen? What if I got here and robbers already took over my house? Maybe they don't like me anymore.
That was a short snippet of a much longer video. But the main kind of point that we want you to take from that is, as adults, we know what our anxious thoughts sound like, but maybe we forget that teens are also facing mental health struggles and they're also dealing with very similar types of anxious and depressed and sad catastrophizing thoughts. And so we know that the teen mental health crisis, youth mental health crisis is high, like worse than ever right now. And so this is recent data from, I think, the CDC. 64% of teens feel that the world is more stressful now than when their parents were their age. 1 in 6 teens report experiencing specific negative emotions all the time or often. And 1 in 4 have been diagnosed with a mental health condition. And so teens are really facing mental health struggles today. And we know that 50% of mental health problems surface by age 14 and 75% surface by age 24. So the vast majority of mental health problems, if they're going to happen for somebody, happen by age 24, and half of them happen by age 14. So this is not just, so the mental health disorders that we're going to talk about, there are certainly not just adult problems. These are things that the symptoms start to arise in people maybe much, much younger than we're actively looking for. And so we want to be aware of what the youth mental health struggles are so that we can be proactive when these symptoms might arise in young people that we care about, so we can get them the help before it gets worse. This is CDC data of self-reported youth mental health challenges among teens, high school students. And so this is, you know, some of these numbers are kind of alarming, seeing that 10% of students have attempted suicide. Almost a quarter have seriously considered attempting suicide. 30% experience poor mental health in the past 30 days, and 43% experience persistent feelings of sadness or hopelessness in the past 30 days. And so these numbers are certainly alarming. A large number of adults or a large number of adolescents report serious mental health issues. And we know that this is not uniform across all students. We know that LGBTQ plus students are much more likely to have experienced poor mental health in the past 30 days and are much more likely to have attempted or considered attempting suicide. And we know that it's also not equal among race and ethnic minorities. So now talking about the co-occurrence, so the two happening at the same time, of a substance use and a mental health disorder. And so co-occurring disorders, COD, is the presence of both one or more mental health disorders. So a mental health disorder abbreviated to MHD, and substance use disorder as SUD. And so this is a clinical term. So this means that someone meets those clinical criteria for having both a mental health disorder and a substance use disorder. And it's important to know that COD, this co-occurrence, affects all people across all demographic groups. It certainly does not discriminate. And this is important that we talk about this, especially during Mental Health Awareness Month, because compared to people who only have a mental health disorder or a substance use disorder, people who have both have more profound functional impairment, have worse treatment outcomes, they have higher morbidity, so higher kind of illness, and mortality, so death rate. Their treatment is more expensive. They're at higher risk for homelessness and incarceration, and they're at higher risk for suicide. So many of the things that we're worried about when it comes to young people is made, so much worse if they have both a mental health disorder and a substance use disorder. And so how common is this? When it comes to adults, about 22 million adults in the United States had a co-occurring disorder. This was from 2022. And that's including 5.3 million young adults, so those aged 18 to 25. About 1 million adolescents aged 12 to 17 had a co-occurring major depressive episode and a substance use disorder in 2022. And so we know that these rates are higher among females than males, which is important to note. And unfortunately, only about 20% of these people received treatment for both their substance use disorder and their major depressive episode. We'll get into it in a little bit later, but major depressive episodes is one of the most common co-occurring mental health disorders that goes along with substance use. So about 50% of this group received treatment for their depression, but not for their substance use. And then only 2% of this group received treatment for their substance use disorder, but not for their major depressive episode. And when we get to the barriers section, we'll talk about this more, but it's very difficult for people who present to treatment with both a mental health disorder and a substance use disorder to get good treatment for both of them at the same time. Often, as we see based on these numbers, treatment centers will want to treat the mental health disorder first and then kind of put the substance use on the back burner. But as we'll see, we know that that's not kind of the standard of care that we would say is ideal. And so mental health challenges, we know that if a person is struggling with negative emotions or wanting to ease untreated symptoms of a mental health disorder, they might self-medicate with substances, especially if their mental health disorder is not very well treated. And so we call this a bidirectional relationship because we know that a mental health disorder and substance use both affect the other, so they impact one another. We know that between 30 and 45% of adolescents and young adults with a mental health disorder also have a substance use disorder. and 65% or more with a substance use disorder also have a mental health disorder. And so this is important because in a young person's life, if we know and we see that they're struggling with negative emotions, or they're showing maybe the signs of anxiety or depression or some other mental health struggle, we need to be aware that they are at higher risk for self-medicating and then potentially being at higher risk for a substance use disorder. And so as the adults in a young person's life, if we're aware of this relationship, we can try to prevent that co-occurrence before it starts. And so these are the mental health disorders that are commonly occurring with substance use disorder. We'll review some of these in more detail, some of the ones that are more common in children and teens. But commonly occurring with substance use disorders are major depression, anxiety disorders, ADHD, eating disorders, post-traumatic stress disorder, so PTSD, and then bipolar and schizophrenia. When it comes to, we're not going to talk too much in detail about eating disorders, but I did want to point out that almost a quarter of individuals with anorexia and more than a third of those with bulimia are also diagnosed with a substance use disorder. And we also know that self-harm is also something that commonly co-occurs with substance use disorders. And so a little bit about depression. So depression is one of the mental health disorders that is very likely to co-occur with a substance use disorder. This graph shows different types of substance use, comparing people who have had a major depressive episode in the purple bars, and then those in yellow, those who have not had a major depressive episode. So people who have been diagnosed with depression, and then people who have not been diagnosed with depression. And so you'll see with every one of these substances, alcohol, nicotine vaping, marijuana, other illicit drugs, and prescription drugs, those who have depression are often much more likely to use substances than those who don't have depression. We know that teens with depression had 3 times higher rates of substance use disorder compared to teens that do not have a depression diagnosis. And so this is just really important for parents to be aware of. And a little bit more about depression. We don't want to go too far into the kind of clinical definitions of all of these mental health disorders, because I feel like a lot of us are aware of what these are, but we'll talk about them and their relation to substance use. So when it comes to depression, youth may use substances to dull painful feelings and cope with the persistent negative thoughts that are common with depression. So they may be very tempted to self-medicate because they're feeling so low. Nearly a third of people with major depression also have a substance use disorder. And so we know that substances affect the reward centers of the brain, and these are the same areas that are associated with depression. And so unfortunately, for people who use substances to try to medicate their depression, can make them more depressed when they're not using the substances. And we know that this is especially damaging when it comes to alcohol and young people, because we know that alcohol affects adolescents differently than it does adults. Instead of getting kind of sedated like adults do when they drink, teens get more energetic and are more likely to engage in risky behavior, including self-harm, which we know people that are at, people who have major depressive episodes are also at a higher risk for self-harm. And so adding extra risk on top of that if they're drinking. Anxiety, youth may, again, they may feel tempted to self-medicate and to try to alleviate anxious feelings that they're having. And for a teen that's already using substances, the effects of substances might cover up or mask the anxiety symptoms, which might make it more difficult to assess how their anxiety is doing. And then similar to depression, some might feel that their anxiety is much more intense when they're not using substances. There was a large survey that found almost 18% of people with a substance use disorder met the clinical criteria for an anxiety disorder. And co-occurring generalized anxiety disorder is associated with accelerated progression from first use of substance to onset of substance use disorder. And so what that means is for someone without anxiety, the timeline looks different for everybody, but for example, someone who doesn't have anxiety might have their first sip of alcohol at 15. And then if someone is going to develop an alcohol use disorder, maybe that happens when they're 30. Research shows that for people who have a generalized anxiety disorder, that process can happen much faster. And so for someone who's trying alcohol at 15, it could progress to an alcohol use disorder by the time they're 20, 21, 22. And that's just because of this co-occurrence. We also know that individuals with specifically a social phobia, so social anxiety, are 2 to 3 times more likely than individuals without social phobias to develop an alcohol use disorder. And I'm sure that we can all imagine that that kind of makes sense for someone who has really intense social phobia and social anxiety. They may feel that in those social situations, alcohol helps them to alleviate those really anxious feelings. But then again, the flip side, when they're not using it, that anxiety increases and it gets worse over time. ADHD. So ADHD, the structural and chemical brain differences that are associated with attention deficit hyperactivity disorder also make young people more responsive to the effects of substances and more likely to engage in repeated substance use. So nearly a quarter of young adults with a substance use disorder also have ADHD. Kind of interestingly, people who use cocaine often very easily have ADHD. And I'm sure that we can imagine the types of medicines that are used to treat ADHD are stimulants, and cocaine is a stimulant medication. So for people who have ADHD, cocaine is often used to self-medicate and kind of regulate those hyperactivity feelings. Similarly, about 40% of adolescents who engage in problematic cannabis use, marijuana use, have an ADHD diagnosis. They can be drawn to a lot of different substances to try to self-medicate with ADHD, things like nicotine and marijuana, and they may be tempted to misuse both prescription and other types of medication. And because of these stimulants, some parents might be concerned that taking stimulant medications will lead to substance use down the line. But this has been studied, and research suggests that if prescribed appropriately to kids who have an actual ADHD diagnosis, the medications can actually help avert substance use, and the child will be less driven to self-medicate, which is really important. Likewise, for kids who have severe ADHD and are not receiving treatment for it, the risk for substance use increases. PTSD, so post-traumatic stress disorder. 62% of children and adolescents in the US have been exposed to a traumatic event, and about 16% of those will go on to develop PTSD. We know that adults with PTSD are much more likely to have a co-occurring substance use disorder than those without PTSD. And in most cases, we know that PTSD, so the traumatic event and the traumatic stress because of that event comes first, and then the substance use comes after. And that I'm sure makes some logical sense. Someone has a very traumatic and stressful event, develops PTSD because of it, and then they try to self-medicate to alleviate those feelings and end up with a co-occurring substance use disorder. There is good evidence of very good outcomes with medications that can treat both PTSD and substance use together. So if you've heard of things like naltrexone, which is also an opioid use disorder treatment, that has good evidence of treating PTSD and substance use together. And briefly about bipolar, nearly 60% of individuals with bipolar have a co-occurring substance use disorder. People with bipolar are drawn to, again, a variety of substances, but specifically nicotine and alcohol. And importantly, for people who have bipolar but have not yet had their first kind of manic episode, substance use can trigger that first manic episode. And unfortunately, for people who are seeking treatment for bipolar and are on medication, substance use at the same time can interfere with those medications and make them less effective. And so we really want people who are getting treatment with bipolar to try to not use substances. And now I am going to pass it off to Linda to talk about risk and protective factors and kind of how co-occurring disorders come about.
Great, thank you, Corey. So you just heard a lot of information about what kind of disorders go together and you know what to look out for and a lot of numbers. But what I want to try and describe is sort of the process by which these two sets of symptoms and disorders typically go together and how they come about. So we may have a child who has mental health problems, we may have a child who has substance use problems, we may have a child who has neither, and ultimately they develop issues with substances or mental health challenges, or in a more severe case, a disorder of each kind. And it's really important to understand sort of the pathways. And we kind of think of these pathways in three buckets. The first is that the person has an existing mental health challenge or one that's kind of emerging in adolescence, young adulthood, which is when we see a lot of it. And because of those mental health symptoms, they turn to substances, as Corey kept saying, to self-medicate or to alleviate or ease some of those mental health symptoms. And that's a very common pathway. So the mental health challenge comes first. The child or young person is not receiving adequate treatment or care or remedies for that mental health problem. So they seek them out on their own and they try and kind of make those symptoms go away or feel better by using marijuana or nicotine or alcohol or prescription medications or opioids. And ultimately what ends up happening, as we know, substance use does not really help mental health problems. They kind of exacerbate them, make them worse. And then the person might end up then using more substances to deal with those worsening symptoms. And it sort of spirals into this co-occurring disorder where the young person will end up having both a mental health disorder and a substance use disorder. So that's one pathway. Another pathway is really just that a child or a young person might be predisposed or have a tendency to both. Often that's a genetic tendency, something from a family history, may or may not be due to any kind of particular behaviors that they engage in, but they just may be prone to both substance use problems and mental health problems. And over time, in certain ages, those are more likely to hit, and then they will develop co-occurring disorders. So the third pathway that people think less about and aren't as familiar with, but it's quite common and really important to consider, because that's kind of where parents and other caring adults have the most leverage and most opportunity to step in. So what we see with this third pathway is that a young person starts using substances. They may have not had any mental health issues beforehand. They just start experimenting, or they're using a prescribed medication and then kind of misusing it. And the use of the substance itself is what brings on the mental health problem. Because as we've talked about in other webinars about substance use, every type of substance use, whether it's nicotine, alcohol, marijuana, cocaine, heroin, prescription medications, they all cause mental health symptoms to varying degrees. So what we see in this third pathway is no mental health problems. A young person's just using substances, maybe socially, maybe more intensely, and ultimately that brings on the mental health challenges that that young person will experience. Then they start having those mental health challenges and they self-medicate with substance use, and you see that kind of cycle repeat itself. One thing I like to point out is that sometimes that initial substance use is not your kid going off and drinking with friends or smoking in the bathroom, or, you know, using marijuana behind your back. It can be that the child is prescribed medications for a legitimate procedure or surgery they had. Often it's for kids who had Like a teenagers, young adults get their wisdom teeth removed, and then the dental professional gives a bottle of some kind of pain medication, painkiller. Usually too much is in there. Usually it's not needed. The child might start taking it and may become addicted to it if they use too much or use it a little bit outside of the realm of how it was supposed to be taken. And there you go. That child now has a substance use problem, which they'll then which might then cause mental health problems, etc. We see this with kids who get surgeries, sports injuries. If you might remember at the height of the opioid epidemic, when it was like prescription medications that was causing most of the opioid deaths and overdoses. In many, many cases, these were young people who had no signs or symptoms at all, and then were prescribed painkillers due to a sports injury, or again, just their general surgery, some procedure that they had, and that just sort of got the cycle going. Often if it is for something like a sports injury, where let's say sports is the child's whole life and it's really important to them, and then they have the surgery and then they're out of the game for a while, they could develop depression because of that, feeling isolated, feeling like they lost something important to them. And then that can kind of spiral into more substance use, mental health problems, depression, more substance use. So these are kind of, these build on each other. But again, the three pathways are mental health challenge first, where somebody then takes substances to make it feel better. Someone has a tendency toward both and they just both emerge, or someone has no mental health challenge at first, uses substances, and that brings on the mental health challenge. And it's just important to know those three mechanisms. So obviously, tons of kids have dental procedures and get prescribed pain medications. Tons of kids feel depressed or lonely or sad sometimes, or anxious about things, and they don't all develop, obviously, thank God, a co-occurring disorder. So what puts certain young people at higher risk than others? And those are what we call risk factors. Like, what are the things that increase the risk in a young person developing these problems? Often it's something we can't put our finger on or detect in advance. It could just be differences in how our brains are structured or how our brains function, some sort of genetic difference. It's really impossible to know when you're just looking at a child if they have those tendencies or not. So often that's a risk factor that we can't identify in advance. And I'll just say one thing about that. When you are talking to your child about why using substances could be very risky, and they say, well, come on, all my friends, they do X, Y, and Z, they use, and they're doing great. They do get A's in school. They're doing great in sports. Everything's fine. It's sometimes important to say, well, some people are just naturally more prone than others to develop a problem when they use substances, and it's really impossible to know in advance who that person might be. So those friends you're seeing could be, not have these genetic or structural differences in their brain that put them at higher risk, but this child might. So you have to be super careful with using substances for that reason. Then there are the more obvious risk factors that we can detect and hopefully intervene early enough to kind of protect the young person. So that's if the child has experienced some significant stressful events in their lives, they've experienced abuse or trauma. Bullying is considered a type of stressful event, abuse and trauma that a lot of children are exposed to. It doesn't necessarily mean if someone experiences trauma or bullying that they're going to end up with a substance use problem, a mental health problem, or a co-occurring disorder. These are just things that increase the risk of it happening. If there's a really difficult family dynamic, a difficult parent-child relationship, that increases risk. Major life changes and disruptions, so often things like a kind of really bad divorce that, or a lot of moving for the child who moves from place to place a lot doesn't get to kind of have that stability and maintain friendships and just the predictability of life. Kids who don't feel connected to school or their friends, who feel very isolated and alone, those who feel unsafe, whether at home or at school or in their community. Obviously, kids who have a lot of illness or suffer from diseases or pain where they may seek out substances to kind of help that, or it might also make them feel isolated and depressed. And again, the last one is an obvious one, but just using substances is a risk factor for developing these disorders. It's really important because it's on all of our minds all the time to talk a little bit for a second about the role that social media plays in all of this. Prior to social media, if a young person Well, if a young person felt isolated or lonely, it was often more apparent. It's kind of hard sometimes for parents to know right now because all kids are just staring at their phone all the time. Some have a great social life anyway, and some don't, and it's kind of hard to know. But we do know that since social media emerged, this sort of loneliness, isolation, depression, anxiety, a whole range of mental health problems that kids are experiencing have gotten worse. We know that kids who spend more hours on social media on a regular basis suffer worse mental health symptoms. We know it's more risky in many cases for girls than for boys, just in terms of how they use social media in that way. Some of the reasons for the negative effects on kids' mental health of social media is that it disrupts their sleep, which is essential for good mental health. They may be more exposed to bullying online, which is very common and hard to detect. They may just be sitting around too much and not have exercise, which we know is a risk for, for poor mental health. And we also know that kids who are on social media a lot, who experience mental health problems, the kind of mental health problems they tend to have is more of those, what we call internalizing, or things like anxiety and depression that's hard to detect, as opposed to those where a kid is acting out or very aggressive or very, angry, which is easier to detect in many cases. The other factor about social media for why it plays a role in both the mental health problems and the substance use is because kids now have a way to access substances, most often pills, but also marijuana, vapes, anything, illegal drugs, over social media. There are many platforms where it's very easy for young people to illegally access pills and other forms of substances without any adult knowing about it. And these are hard to detect because they're often done on these platforms or apps where, the messages and the exchanges disappear and can't be detected. Just a point always worth mentioning that a very high percentage of the pills and substances that are bought over social media nowadays are contaminated, are counterfeit, they're fake, they're not what they say they are, and they often 6 to 7 times out of 10 may contain fentanyl, which is that deadly opioid that we've all heard so much about. So it's really important to talk to kids about never ever using social media, never buying any kind of substance over social media. It's impossible to know what's in them, what they're getting. And the only time to take a pill is if it's given to you by your doctor through a pharmacy. That's a whole other topic, but just worth mentioning here as well. So with all, the protective factors are sort of the things that if a young person may have some risks for substance use and mental health disorders and the co-occurrence of them, there are actually things that can protect that child. And those are usually the flip side of what the risk factors are, but we'll point out a couple here. Having an adult who cares about you and provides support and notices what's going on and intervenes is critical. Having a sense of safety and security, whether it's at home or in school or in one's community, one of the most important things for young people is a sense of stability, predictability, security. So that could be just knowing, oh, every night my family sits around and we have a snack together or a meal together, or we watch a show together, or we have this conversation at 11 p.m. at night. We just chat about our day. Just something predictable where there's a safety for the young person is really critical. Kids who feel connected to their school and friends and have a social life and feel like what they do in school matters and they have a kind of academic aspirations and all that. Kids who feel like it's important to be healthy. So those who exercise, get involved, care about their nutrition, that they're going to be protected from these issues to some extent. Those who don't feel like they have to engage in substance use every time they want to do something social and fun. And if there are those opportunities in their environment where they have substance-free social activities for young people, that could be very protective. Kids who develop good problem solving and coping skills obviously are less likely to struggle with mental health problems in many cases. And those are skills that can be learned through parents, through schools. There's lots of programs now in schools where we try and teach kids how to cope effectively, how to solve problems, how to manage emotions. Those are really important skills that not everybody's born with, but everybody can learn, and that will really protect against developing a mental health problem and therefore a substance use problem and co-occurring disorders. Same with resilience, these skills where you learn how to sort of face challenges and come out ahead and not get pulled down from them. There's lots of research showing that spirituality, religious affiliation, attendance at religious, events, whatever, that's protective for kids. Again, because, for various reasons, one of which is it provides community, it provides connection, it provides, some sense of purpose. What we find most often is that having a really strong bond with at least one trusted adult, other than a parent usually, but it could be the parent, is one of the most protective things for young people when it comes to co-occurring disorders. And that's obvious. The person is going to be looking out for the child, will detect if something's off, will be someone who the child might feel like they could confide in and get help from. And again, it doesn't have to be some major adult figure. It could be an older sibling, it could be an older cousin, a teacher, a coach, a community leader, and it could be a parent if that's what it is. So despite what we do, some kids are going to develop mental health problems and substance use problems and co-occurring disorders where they experience both. And if you didn't catch it from Corey's stats, which I think it was quite clear, it is not uncommon at all for young people to experience both. They kind of go hand in hand. Unfortunately, the way our system is set up in this country has not recognized that, even though it seems quite logical that someone who struggles with their mental health might seek out substances, and that people who have substance use problems might experience mental health problems. The way our prevention, treatment, intervention, all those systems are set up have not traditionally really recognized that. And so there's been a lot of barriers to getting good treatment. What we do know is that there's an incredible window of opportunity for families to help a young person, and that the time between when they start seeing mental health problems in a young person and that person develops a substance use disorder, there is a window there of opportunity, and that is a key window of opportunity. Almost 90% of people with a co-occurring disorder had a mental health disorder before the substance use problem started. And typically, this mental health disorder can be seen in early adolescence, around age 11, and then the substance use disorder doesn't fully develop till 5 or 10 years later. So there is a really significant period during adolescence where we're seeing a kid who has some mental health problems, and then we have a lot of time, or a significant amount of time, before that substance use disorder sets in. And that is the key window of opportunity to intervene and help kids before that co-occurring disorder is solidified. Once a young person has also developed the substance use disorder, it becomes really, really difficult to treat both. It's not impossible, and more there are programs now that do just that and do it well, but it's a little hard to find, and there's a lot of barriers to that kind of treatment, which we'll talk about. So what are some of those? There are a lot of qualified professionals out there who are great at treating substance use problems or addiction, and there are many who are very great at treating mental health problems, and not as many who are great at treating both. And the interventions overlap, but they're not always exactly the same. We also know that it's hard for kids to acknowledge that they have a problem and that they want to get treatment or that they need treatment. So having them acknowledge and seek out treatment for both a mental health and a substance use problem, that's even harder. There is a lot of stigma or negative feelings about people who struggle with these issues, or about giving medication to people who have these problems, even though there's medications that are extremely effective. So that can get in the way. Our insurance system, our healthcare system just does not cover the costs of these very well. So not only is there a shortage of professionals who are good at treating co-occurring disorders, even if you find someone, it's often very hard to get the right insurance or be able to pay for it. Often for a young person, it requires going to multiple days of treatment. They don't necessarily have to be inpatient or sent away to a rehab facility, but even if it's an outpatient thing, it could be very hard to get a kid to go, find a way for them to travel there, given school, given parents' working hours. Often these services are not provided on the weekends, so there's just those sort of logistic barriers. There's long wait lists. We just don't have the workforce in this country that's able to meet the challenge of this booming mental health problem and crisis that we're seeing among young people. So we know that a lot of kids end up going to emergency rooms because there's just like not a treatment provider out there. So it's just hard to get the treatment you need. And we also know that even if you get a child into an adolescent treatment program, they may not offer the best kind of care for these co-occurring disorders. And one thing we do know that's really important for a young person is to have their family be involved in their care in most cases, and that's often not offered in treatment programs for co-occurring disorders. Surveys of parents show that they report facing many barriers if they try and seek help for their own child. About 60% said they had difficulty finding a mental health provider who can handle both the mental health and substance use issues, or even just one. The financial concerns are a big issue, and even though people have medical insurance, less than half of the parents in the survey said that their insurance covers mental health or substance use issues. And one thing that can be a good idea if a parent doesn't know where to turn is to ask their pediatrician, but even then, their child's pediatrician, but even then, many pediatricians just don't really have good resources to offer and are not well trained in addiction care or mental health problems to know how best to help. I'll just give a little anecdote for 1 second. I gave a talk a week ago about similar issues, and I got multiple requests afterwards saying, I want to get my child help. They seem to have substance use problems and some depression or some anxiety, and I just cannot find anyone. So there are actually resources out there. It's just not that easy to find. Here's a slide just showing some of the additional things that teenagers themselves say when they acknowledge that they need treatment or care for why they don't end up getting it. Again, it's that stigma issue. They feel like they should be able to handle this on their own. They're worried, what are people going to think about them or say about them, which is a constant concern for teens, even those who have no issues with substance use or mental health. So just think how much more serious it is for those kids who are struggling. They really worry that their information might not be kept private. People will find out. That the adults, friends around them, religious groups, whoever they belong to, might disapprove of them getting treatment or acknowledging these problems. Again, there's access issues. They just don't know how to go about it. And some just don't feel ready for treatment. They think that that it won't help, that they can handle it on their own, that it will go away. These are all things that teenagers themselves report. But if you're in a situation where you are concerned about a young person, whether it's your own child or somebody you know, there are ways to get help. And it's really important to intervene earlier rather than later. As we said before, with that window of opportunity, you do not want to let this fester and go too long without getting some help. So what are some things that parents and caregivers can do? Some of the things you see here are ones we talk about all the time when it comes to intervening or preventing for substance use problems. You want to be talking with your kids or with children honestly and openly and frequently so that you know what's going on with them, so that they feel that they can come to you if something serious is going on, or even not that serious, but just something that they need some help with. And the more we're kind of open to listening to our kids and just being a constant presence in their lives, the more we can recognize if something's gone awry, or if they be there for them if they do choose at some moment to actually speak and tell us what's going on. So don't get dismayed if it's day after day after day after day of just some grunting and not much. But if they know that you're a constant presence there and that you're always willing to listen, one day they'll open up and may say what's going on, and then that's your opportunity to help. So we want to really try, if we do think a child is having some struggles with mental health or substance use problems, we want to have some clear expectations about what we're going to allow or not allow, what the boundaries are, and how we hope that they will get help and what some of the goals are. We want to encourage them to engage in activities that are going to be healthy for them, that don't involve substance use. So a lot of times a child who is actually receiving treatment for these problems, they're not given anything else to do. So when they come out of treatment, all they know is how to kind of alleviate their negative emotions with substances, but they have to be given some other opportunities, some other ways to kind of feel better or address those things. And that's really important. We want to just be very aware of how our kids are feeling and acting so that we know if something's wrong. We want to model healthy behaviors for our kids, but also model getting help if something's not right. So when we ourselves are feeling mental health struggles or substance use problems, and we show our children that, you know what, you don't have to live with this, and there's help out there, and we're going to get ourselves help. That's a greatest gift we can give kids, is modeling seeking help if you need it. For those who have a serious substance use problem or even not, it's really a great idea to keep Narcan, which is that opioid drug overdose reversal medication, in the home and on hand, because it could save a life. Happy to talk more about that if someone has any questions. And it's really important to talk with any therapist, any health professionals that the child sees, whether it's a pediatrician, a dentist, a psychiatrist, anybody, about that child's co-occurring disorders. Because if they don't know, let's say that a child with a mental health problem also has substance use issues, they may prescribe medications that can make those substance use problems worse. Or if they're addressing the substance use problem, they may not be treating the mental health issues that are really underlying it. So it's really important, as hard as it may be, to be as honest as possible with the providers. I think we can skip this, Corey. I just want to make sure we have time to keep moving. There are some online services that are advertised that I would caution against without doing a lot of research. A lot of these are not really very good. They're not well vetted, and they may cause more harm than do good. And we're not trying to pick these out specifically, but it's always better to go through a professional that you know in your community than to start out going online to get help for a young person. What's really important when we're talking about treatment for kids with these problems is to have integrated care. So as Corey mentioned earlier, not only do you want to intervene early, but often what happens is the providers will say, well, we'll treat the substance use, but we don't deal with the mental health problem. Or, oh, we'll treat their depression and anxiety, but they're going to have to go somewhere else to deal with their marijuana use problem or their alcohol problem. That doesn't work well, and it certainly doesn't work well for young people, because again, when you have a co-occurring disorder, they're feeding off each other. These two issues go hand in hand, and it's almost impossible to have successful treatment if one is treated and then the other is kind of dealt with later or separately or by a whole different provider, which just makes the kid have to like travel to 5 different places. It's just very chaotic and not integrated. So there are now more and more programs that do provide this integrated treatment, and particular professionals who do it well. And to the extent it's possible, that's who you want to get, and that's what you want to do, is get integrated treatment where both the mental health and substance use problem is treated at the same time. The child is provided with healthy alternatives. They involve the family. And regardless of what you come in for, if you kind of come in because the kid is using too much marijuana, they're kind of assessing and determining if the child also needs mental health treatment, and vice versa. If you're coming in because the child has depression, that program or therapist is saying, well, let's find out about if they're using substances and maybe we can address that as well. So just to reiterate, the best effective care for co-occurring disorders are clinical interventions that deal with both mental health disorders and substance use problems at the same time. And on the right are some examples of those types of therapies, involving the family and providing support to the family whenever possible. And there are specific methods for doing that. And providing extra support for the youth that's outside of the therapy itself, again, where they have substance-free activities to engage in, social activities, and where their coping and problem-solving skills are built so that they can withstand challenges as they go on. We do want to share a couple of resources with you in the few minutes we have left, and then we'll certainly stay on for questions. So Partnership to End Addiction has done a lot of work on co-occurring disorders, and we have a whole, I guess you could say, report or guide on how to recognize problems and how to address it in children. We worked with the Child Mind Institute on this. We also have a place on our website with lots of relevant articles. We have one-on-one services, direct support for parents and other caregivers who are concerned about a young person, and these are free to anybody. You just go to drugfree.org, get support, and you'll see all the options and various levels of anonymity. So you don't have to identify yourself. You could just kind of, maybe it's through text messaging. You could speak to someone. You don't have to divulge all your information, but you can get a lot of great support and resources this way. We have specific resources for parents and caregivers of LGBTQ youth who are at higher risk of both of these kinds of disorders as well than other kids. We have a lot of resources about how to find and help pay for treatment and what to do if you're facing some barriers there. So those are a lot of useful resources that we provide as well. We do like to point out that we work with another organization called the Harris Project that really focuses in on co-occurring disorders specifically and has a lot of fantastic resources on this topic as well. And that's it. This is our contact information, and we can, I guess, open it up to questions if anybody has any.
Great. Thank you so much for that amazing presentation. I feel like, I've worked with youth for so many years now. We always hear the adults, with the mental health, the co-occurring disorders. We don't hear that a lot about the youth. So I really appreciate all that information you share today with our parents and educators online and, other professionals out there, because it's so important to talk about. And, the one thing that you did bring up was those lack of resources, which is really unfortunate because, even here in New Jersey, we really struggle with that. And us working with youth, just in this county, in Monmouth County, the lack of resources for youth for substance use treatment. So I think the more conversations we have, the more people we, get this information out to, hopefully some more changes will be made and more treatment will be available for our youth out there. So thank you for all of that information. It was so informative and so helpful.
Thank you.
So if there's any questions, I don't know if Sam or Enza, if you have anything, any questions that are out there for anyone. Okay, maybe not. Well, thank you again for all that information. We do have a survey. There is a link in the chat, or here is a QR code. We're always looking for feedback, the way to, make things better for everybody who does attend these webinars. So if you can take a few minutes, scan the QR code or go online, complete that survey, we'd really appreciate it.
And Randy, I just want to mention that I think you also put the webinar online. So if somebody missed it or wants to see any of those resources we shared, you can check those out afterwards.
Yes, thank you, Linda, for reminding me. Yes, we do have all these webinars are recorded, so you can go to Preferred, our website, and take a look at that, or reach out to us at Compass. We're more than happy to provide any information or resources for you. Even if you're not in Monmouth and Ocean County, we will be glad to connect you with other communities out there throughout the state of New Jersey. Okay, I think that's it. So thank you again, Corey and Linda, for another wonderful, informative webinar. And we hope you all have a great evening.
Thank you, Randy.
Thanks so much.